like to call the meeting back to order. And then we need a roll call of the board, please.
Randy Weitela.
Mary Sanders.
Stephen Frickman.
Kay Olson.
Patty Winchell-Dahl.
And I'm going, is this on, Kimber? Is this on?
Yeah.
All right.
I think so. Still testing.
Okay, does this sound better to people? Can you hear this?
Could be up a little bit.
Yes, I'm not sure what that is.
Is
Is it, it says on.
Yeah,
Got it on
you have to be
then.
really close to them.
You have to be really, really close? Any better? No.
Might be the,
Hello?
Is
Yes.
there a
might
volume?
be the amplifier.
Is there something on there that, we had it on because we tried it earlier and it sounded pretty good.
Sort of a big deal.
Oh, on the side.
Okay, which way with the button, is that any better?
A little.
Now it is.
Now it is.
Now it is, all right. So I will start with it since I'm starting off, and we just have roll call. Approval of agenda. Are there any additions, corrections, anything that we need to take care of with these? If not, I need a motion to approve. All in favor?
Aye.
And then this is our time for public comments. Is anyone who would like to speak, and if so, you need to sign in so that we know who is talking to us.
Y'all know my name is Deneen. I'm the daughter, guardian, and power of attorney for my mother, Ethel Walsh, who lives at the care center. On March 23rd of this year, I wrote all of you regarding a staffing crisis that occurred at the care center on the same date. On that day shift, there was one nurse and one certified nurse's aide scheduled for 19 residents on the woods side of the building. This scheduling issue was known since at least March 19th, Tuesday of that week. I was told the temporary director of nursing was out of town, working remotely some days and on vacation others. This day was left for direct care staff and family to figure out for themselves. As I wrote, some residents were dressed and left in bed at last rounds at 5. One night nurse stayed until 9 to help pass meds and assist a person with eating. Besides the CNA, there was a hospital unit coordinator on the unit helping with dressing, feeding, and toileting. She does have her state certification. I got there at 7:45 to get my mom up, dressed, and fed. I assisted in feeding 4 other people who could not feed themselves as the one aide and the huck were answering lights and getting people up. Currently, there's also a person who needs one-to-one supervision, so either the huck or the aide has to attend to that person once they were up. Evening staff came in at 11 to 11:30 to assist with the rest of that shift. I detailed issues in my email to you all about the evening shift as well. This schedule was left a dangerous shambles while the director was out of town working remotely, and who was left in charge or accountable in her absence? If you're working remotely, are you still not accountable? Do you designate this responsibility to someone locally available? If so, who and where is it posted? I sent another email Monday the 25th updating on how the 24th went. It was not fully staffed, but it was better. I asked the following question in both emails. Who is accountable when the schedule is incomplete and the director leaves town but is still working remotely and the coverage for our families is dangerously incomplete and unsafe? I received responses from Patty and Steve telling me they were very concerned and would look into this. I received an email from Kimber thanking me for my observations and concerns, but nothing addressing the issue. I've since contacted both the state and Cook County regarding these issues. I've not heard any follow-up from anyone other than Steve. I have not had any follow-up from you, the board, or Kimber, except for Steve on the 25th. I sent another email Tuesday, April 16th, asking who is responsible when the director is working remotely, as well as a definition of short staffing. I also asked for the policy regarding safely staffing the care center and the policy of working remotely. I still have received no response. Interestingly enough, I did email Senator Housechild right after yesterday's email to the board and Kimber and received a response at 9 o'clock that morning. Board members, I'd like to know now what the rules are regarding answers to questions that family members and constituents have if you won't respond to your emails. I will close my statement with the following combined federal and state Bill of Rights for residents in Medicare and Medicaid, certified skilled nursing facilities. I've sent you parts of this document before. All residents in long-term care facilities have rights guaranteed to them under federal and state law, and these rights exist under federal and state law and apply to residents of facilities certified under Medicare and Medicaid. Under continuity of care, residents shall have the right to be cared for with a reasonable regularity and continuity of staff assignment as far as the facility policy allows. This is why I would like to see a copy of your emergency staffing policy. Under planning and implementing care, the state specifically requires residents will have the right to appropriate medical and personal care based on individual needs. Appropriate care means care designed to enable residents to achieve their highest level of physical and mental functioning. I really think each and every one of you should spend 8 hours in the care center, day or evening shifts, sitting next to the nurse's desk, listening to the call lights and the floor alarms while there is only 1 or 2 nurses' aides scheduled. While you're sitting there, picture the newest aide being the only one scheduled to work on a day shift and wonder to yourself why it's so hard to gain and keep employees when that's how they are treated. All I can do is wait for somebody's response and continue to observe and document and report. I'm very upset. I'm very concerned for all the residents, the staff, but especially my mother.
Is there anyone else who would like to speak?
No.
Okay, if not, we can, are there any corrections to the minutes? If not, I need a motion to approve. Second. All in favor?
Aye.
Updates. We have the clinic board, Kimber handed those out at the beginning of the meeting, their annual meeting, and notes from Kate. So is there anything you'd like from that, or we'll just go ahead and read our own script?